More than perhaps any crisis in the past century, the COVID-19 pandemic has demonstrated our country's need for a strong health system. And, let me not mince words, for massive investment in public health. In recent years, we've been moving in the wrong direction on this front. Our public health workforce has shrunk by more than 56,000 jobs over the past decade. The cost of healthcare has skyrocketed, while investment in our communities dwindled. And disparities in health outcomes continue to divide along racial and economic lines. And yet, beginning before the turn of the previous century and lasting deep into the 20th, our country could boast of a proud history of successful public health initiatives, including the creation of public health departments, founded upon the principle that the health of each of us depends on the health of all of us. Reinvestment in public health must happen for the good of all. It is the key opportunity we have to redress health inequities, particularly those rooted in systemic racism and white supremacy, and to build widespread societal support. Leaders in public health and healthcare also need to shine a critical light on ourselves, thinking hard about how we allocate and use the resources we already have, how to be more worthy of the trust of those whom we serve, what language we use to communicate with those whom we serve, and how to more seamlessly collaborate with partners who also contribute to the production of health. Over the past year and a half, we have seen that even in a city as large as New York, the best way to unite these approaches and improve the public's health is to meet people on their own terms in their own neighborhoods. I am so proud of the work our health department has done in the neighborhoods hardest hit by COVID across every borough. We teamed up with community health workers, faith leaders, care providers, and trusted nonprofits, and we started by listening to them. Together, we set up COVID testing sites and connected residents to needed resources, including food pantries, mental health services, and health insurance. We've grown this network during our historic COVID vaccination campaign, deploying canvassers for one-on-one conversations to build vaccine confidence, visiting over 1,000 community practices via public health detailing, and investing tens of millions of dollars in community-based organizations. By approaching our work with humility and by living up to our agency's core values of science, equity, and compassion, we can proudly say that many lives were saved, even as our work continues. I am exceedingly grateful for New York's community health workforce and their invaluable service. Looking ahead, it's clear that a permanent cadre of community health workers in and from neighborhoods across the city is what we need to fully recover, to confront the health challenges that COVID has exacerbated, and to protect us from the worst outcomes of future emergencies, from pandemics to slower-moving disasters such as climate change. I also firmly believe that public health must work hand in hand across government, the media, and in particular social media, to educate the public and to stop the spread of misinformation that is costing people their lives. All of this takes investment, and all of this takes work. In the wake of the seismic shifts wrought by COVID, the answers have never been clearer, and our will has never been stronger. The time for a public health revolution is now. I look forward to joining with you on this important mission.